Welcome back, Dr. Alan Nassipny, University of Idaho DAT program.
Jim May, University of Idaho.
And today we're going to talk about research and clinical practice and maybe how it might look different in various settings in athletic training. We have, in our program, we have students that are practicing clinicians in the secondary school setting, clinic corporate, professional. We have students that are kind of all over the place. And one of the unique challenges for everybody is that most people, I won't say everybody, the strong majority of our students have to go from collecting virtually no data to how to conduct clinical research in their practice. And one of the challenges is that if that is you, or if that is the case for you, there's a lot of potential changes that need to kind of happen just in order to get going. And so one of our first recommendations would be, if you're not collecting any data, see something that is useful for you to study. Like, I want to know about ankle sprains, or I want to know who my patients are, and I want to understand that, or I want to know the effect of my treatments in the first few visits, or I want to know what the effect of moving to an appointment calendar is, a schedule, rather than people come in whenever they want, and now sometimes I have 4 people, sometimes I have 1. And all of those, from my end, are useful things to study.
Yeah, so it's that perceived barrier of time, which most athletic trainers will resonate with. They have a lack of time. So when we want them, those students, to get a landscape of what their options are, and then to move in that direction to be successful in starting to navigate that, becoming aware and becoming researching your clinical practice in a way that you want to.
And there's some things that we do, like just in general. Like, I want to know how we're treating pain. I want to know how quickly we're returning to function. I might have to break up groups. Post-surgical are different than our chronic pain patients, and different than acute, a grade 1 ankle sprain. So
you could look at, what you're saying is, like, you get a rush, and if you're treating 10 patients with pain in the next hour, okay, what are those results? Or
right,
how would that look?
So it's clearly, from my end of things, just not set up well, right? But it doesn't mean that you can't explore that. And when I say not set up well, it's just not set up optimally for what you're trying to study. And but just because of that might be what you want to study. Because if you find out that, hey, that is a problem, when I see 10 people at a time, or even 4 at a time, I'm not as good as when I see people one-on-one, or maybe one clinician with 2 patients. And so having any data that you collect in some sort of structured, thoughtful manner is going to be good for you. It's going to be useful. And we know that even in studies where we don't do an intervention, but just by the process of studying something, performance improves, right? Because all of a sudden you get a little focus back on what you're doing. And you could study, we talked a lot about treatments and different treatment options, which is what we prefer to study generally. But you could study your outcomes. You could study how much time you're saving, how much money you're saving in an organization, or how much time spent.
So it sounds like you're suggesting that we start to consider that transition from an athletic model of operating the clinic, and switching and transferring to more of a medical model, where the care of the patient population is seen as the priority.
Yeah, and I would say even beyond that, like, I definitely say that, right? And I say even beyond that, we live in a small town here in Idaho, and the hospital that is in town doesn't really do much research. So, and they're kind of a big deal around here. And so it's not necessarily whether you're in a small setting or a big setting. It's the idea that you view data in your profession or in your setting or in your little scope of the world, that you prefer to have some data and use it for what it's valuable for. And if you don't have any, collecting some in a rigorous way or a structured way or anything's better than what you have. And the more you do that, because one of the ways that we learn research the best is by screwing it up. And so the more times you research something and you try to find an answer, or you try to say, hey, I want to say that we're good with this, or that we're having an impact, and then you take it to somebody else, let's say an administrator, and they're like, yeah, but what about these things? All right, let's go back and study that. That's a good point. And so this idea of just starting the process, collecting data, reviewing the data, making changes, involving the stakeholders that are local, like who cares about your research? Is it only you? It's going to be hard to get buy-in from your patients if it's all about you. If it's about, hey, look, I want to study these things so that I can serve you better, I can help you get back on the field, or I can help you get back to work or your life faster, then now all of a sudden your patients and participants in the studies have buy-in. If you want to switch to a schedule format at the high school, let's say outside of that major rush that you have, then you want to go to an appointment schedule, then you're probably going to need some sort of administrator support. Maybe part of that support is not reporting to an athletic director, which is definitely a conflict of interest, but it's how, there's a fair share that are still doing that. It might be the medical model. But it might also just be communication, like, hey, we want to study these things so that we can get better. And if we get better, we can beat, junior varsity high up the street, right? I mean, that's what they care about at times. They also care about the people that are there. And so if you can have a data-centered conversation, or at least data as a piece of that, and you can involve the people that might have a stake in that, and maybe they can give you an angle on that you wouldn't consider. Like somebody says, well, that's good, you just did this ankle treatment on me, but the biggest factor that I know is that I felt like I could do it afterwards, and you didn't ask me about that, right? And so but I didn't notice that I got stronger, I just felt like I could do it, right? So maybe if your participants are more involved and they kind of know what you're doing and they know why you're doing it, now you get your stakeholders involved, and research is much easier and more fun to do.
Yeah, that's what I was just going to say is kind of let go of the research as a thing and make it fun, because once you really get in and start playing with your clinical practice and looking at areas that you can improve and how all that works, one, you're going to learn, and two, it's always going to be productive and helpful for you.
Yeah, and I don't think that a journal article is the be-all and end-all. I could care less about those. We have probably 100 publications or something like that, and it doesn't mean all that much. But there are times when it does, but it's not the journal article that means it. It's when you're doing this research project and you share it with the participants afterwards, and they're the ones that you're treating. Like, look at this is what we used to do, this is what we're doing now. Like, how cool is that, right? Have the conversation of, wow, there's really some fun things that we're doing. And then the students are like, yeah, I was a part of that. And now you get this culture where it's not a bother, it's not a hassle, it's just part of what you do, and everybody's excited because everybody's involved. And man, if you want to have like longevity or sustainability in an area, get a bunch of people who are all kind of cheering for the same side, and then involved in the process. And sometimes when you don't feel like doing it, that momentum that's created by everybody else there will help drive some of the research. So hopefully those tips are helpful, and if you guys have any questions or comments, or you want to receive all the notifications, then just make sure that you hit the bell. Thank you.